1. Tick bite emergency? Know when to remove and when to call a doctor. Prevent Lyme disease. 2. Understanding the surge in tick bites, what you need to know. 4. Lyme disease and red meat allergies, why tick bites are up in 2025. 1. Tick bite emergency? Know when to remove and when to call a doctor. Prevent Lyme disease. Understanding when to remove a tick and when to seek medical advice. In recent years, the number of emergency room visits due to tick bites has surged to a 5-year high, as reported by the U.S. Centers for Disease Control and Prevention. This alarming trend has prompted Dr. Brandon Eilertson, an infectious diseases specialist from Kaiser Permanente in Maryland, to share valuable insights on how to handle tick encounters with family members. Awareness is key. Dr. Eilertson notes that increased awareness about the potential diseases ticks can transmit is a significant factor behind the rise in emergency visits. People are becoming more conscious that ticks can carry diseases, he explains. This heightened vigilance is crucial, especially in the mid-Atlantic region, where tick-borne illnesses like Lyme disease and anaplasmosis can lead to severe health complications. However, he emphasizes that spotting a tick does not always warrant panic, as the majority of ticks do not harbor diseases. When to consult a doctor? Dr. Eilertson advises that if a tick has been attached for more than 24 hours, it is wise to consult a healthcare professional. This time frame is critical because it typically takes about 24 hours for Lyme disease to be transmitted from the tick to a human host. If the tick has been on for less than 24 hours, it's perfectly acceptable to remove it and keep an eye on the situation, he reassures. Identifying tick feeding duration. If you are uncertain about how long a tick has been attached, there are indicators to consider. Dr. Eilertson points out that ticks feed on blood, and as they do, they swell up significantly. A tick that has fed will appear much larger and different compared to one that hasn't had a meal yet, he explains. Proper tick removal techniques. To safely remove a tick, use fine-tip tweezers and grasp the tick as close to its mouth as possible, which is the part embedded in the skin. If the tick breaks and a portion remains under the skin, avoid digging to remove it, as this can cause further skin damage. Instead, seek medical advice for proper removal. After extraction, Dr. Eilertson recommends washing the area with soap and water without the need for alcohol or ointments. Recognizing symptoms of tick-borne diseases. The initial signs of Lyme disease and other tick-related illnesses often include an unusual rash and fever. Dr. Eilertson stresses that either symptom is a valid reason to reach out to a doctor. Timely reporting of these symptoms can prevent more severe neurological issues associated with tick-borne diseases. Lyme disease often comes to our attention when patients present with nerve paralysis or facial drooping, he warns, highlighting the importance of early intervention. Join the conversation. As we navigate the complexities of tick bites and their potential health risks, it's essential to stay informed and proactive. What are your thoughts on the best practices for dealing with ticks? Have you had any experiences that might help others? Share your insights in the comments below. 2. Understanding the surge in tick bites, what you need to know. Imagine spending a beautiful summer day outdoors only to return home with an unwelcome souvenir, a tick bite. This summer has been a ticking time bomb for tick bites in the Northeast, with emergency room visits reaching a 5-year high. But what's behind this surge and how can you protect yourself? Let's dive into the reasons and learn what to look out for. According to the Centers for Disease Control and Prevention, CDC, the number of emergency room visits for tick bites in the Northeast has skyrocketed, with a staggering 229 tick bites per every 100,000 visits to ERs in the region. To put this into perspective, in June 2024, the CDC recorded 167 bites per 100,000 visits, a significant increase. But here's where it gets interesting. The type of tick that typically carries disease in New England is the deer tick, also known as the black-legged tick, which can be as small as a poppy seed. Dr. Thomas Mather, the director of the University of Rhode Island's Center for Vector-Borne Diseases, explains that hot and dry days can kill deer ticks, but with few of those this spring, more ticks have survived to bite people and increase disease prevalence. We had good conditions in May and June for tick survival, black-legged tick survival, and that has caused the number to be higher, Mather said. And this is the part most people miss, the impact on families. Jen Digno, a mother from Quincy, Massachusetts, now carries a tick removal kit with tweezers and band-aids after a scare with her 2-year-old son Jamie. He got a rash and we had to go in and get checked for Lyme disease, but luckily he didn't have it. The rash went away. But it has been a frustrating season, Digno said. So, what can you do to protect yourself? Dr. Todd Eilertson, an infectious disease specialist at South Shore Health, advises patients to be on the lookout for large rashes that can occur with Lyme disease even if there is no telltale bullseye. If it's a deer tick and if it's been attached for at least 36 hours, then you want to call your provider because we can give a single dose of doxycycline, 200 milligrams, and that significantly decreases the risk of developing Lyme disease. Eilertson said. But here's the good news: as hot, dry days are expected to increase throughout the summer, more deer ticks will die. Dr. Mather believes Massachusetts is already past the peak of tick season. However, this raises an important question: are we doing enough to prevent tick-borne illnesses, or are we just reacting to the symptoms? We'd love to hear your thoughts. Do you think we should be taking more proactive measures to prevent tick bites? Or are the current methods sufficient? Share your opinions in the comments below. 4. Lyme disease and red meat allergies, why tick bites are up in 2025. Imagine this: you're out enjoying a peaceful hike in the lush woods of New England, only to discover later that you've been targeted by one of nature's tiniest but most dangerous predators, ticks. These minuscule creatures are wreaking havoc in 2025, bringing with them not just Lyme disease but also lesser-known threats like red meat allergies. And here's where it gets concerning: this year is shaping up to be one of the worst on record for tick-related health issues, especially in the northeastern United States. New England residents are no strangers to ticks. The region is home to Lone Star ticks, deer ticks, which carry Lyme disease, and American dog ticks, known for transmitting Rocky Mountain spotted fever. Yet even seasoned locals are alarmed by what they're seeing this season. Emergency room visits due to tick bites have reached their highest levels in at least 5 years, according to data from the Centers for Disease Control and Prevention. In fact, last month alone, 233 out of every 100,000 ER visits in the Northeast were attributed to tick bites, a figure nearly double the national average of 118. Massachusetts, in particular, has seen a noticeable uptick in tick-related incidents. State Health Department records reveal that more than 0.6% of emergency room visits in May involved tick exposure, compared to roughly 0.4% during the same period between 2022 and 2024. Typically, these numbers peak in July, suggesting we may still be on the cusp of an even bigger surge. Dr. Catherine Brown, Massachusetts state epidemiologist, emphasized that while the data doesn't account for urgent care or primary care visits, it clearly indicates a significant rise in human tick encounters. This year stands out as an anomaly, Brown noted, highlighting the severity of the situation. So why are tick populations exploding? According to Thomas Mather, director of the University of Rhode Island's Center for Vector-Borne Diseases, much of the blame lies with black-legged ticks, or deer ticks, at their nymph stage. These critters are about the size of a poppy seed, making them incredibly hard to spot. What's worse, approximately 20% of nymphs in New England carry Lyme disease. Humidity plays a critical role in their survival. Dry spells in early spring can decimate their numbers, whereas wetter conditions allow them to thrive. Unfortunately, recent decades have brought increased humidity to the region, largely driven by climate change and rising global temperatures. Warmer air holds more moisture, creating ideal environments for ticks to flourish. Ken Mahan, the globe's lead meteorologist, explained further, when dew points climb above 65 degrees Fahrenheit, the atmosphere becomes saturated with moisture. Over time, Boston has experienced a growing trend in the number of days with dew points reaching 70 degrees. The interplay between wildlife and ticks adds another layer to this complex issue. Deer ticks rely heavily on small rodents and deer for sustenance, meaning that fluctuations in those animal populations directly impact tick numbers. However, perhaps the most startling development is the northward migration of Lone Star ticks, historically confined to southern states. Data from Mather's Tick Spotter Project, an initiative allowing citizens to submit photos of ticks for identification, reveals a staggering 300% increase in Lone Star tick sightings over the past 3 years. Areas like Martha's Vineyard and Narragansett Bay are now teeming with these invaders. Allison Cameron Perry, a professional bodybuilder and mother residing on Martha's Vineyard, shared her family's struggles with alpha-gal syndrome, a red meat allergy triggered by Lone Star tick bites. After eliminating meat and dairy from her diet, she's had to work tirelessly to find alternative sources of essential nutrients for her athletic pursuits. But the emotional toll runs deeper. Watching my 3-year-old son play outside fills me with anxiety, she confessed. Long grass terrifies me. We use natural sprays around our yard because I worry constantly about his safety. Young children are especially vulnerable since they don't understand how to avoid risky areas. Experts recently gathered for a virtual panel hosted by the Harvard T.H. Chan School of Public Health to discuss strategies for combating tick-borne diseases. Among the recommendations was treating clothing with permethrin, a plant-based repellent approved by the Environmental Protection Agency. Richard Pollack, Senior Environmental Public Health Officer at Harvard, urged individuals to promptly remove ticks using tweezers rather than waiting hours in an ER. Save the tick afterward so you can identify it if needed, he advised. Dr. Daniel Solomon, an infectious disease specialist at Mass General Brigham, suggested taking doxycycline within 72 hours of removing an attached tick. While the CDC advises this step only if the tick has been embedded for 36 hours or longer, Solomon argued that it's better to err on the side of caution. We can't always determine how long a tick has been attached, so taking a single dose of antibiotics could prevent Lyme disease, he said. Despite the alarming trends, Dr. Brown encouraged people not to shy away from outdoor activities. Instead, she recommended practical measures such as applying tick repellents, wearing light-colored clothing to easily spot ticks, and tossing clothes into a hot dryer upon returning home. For pet owners, Pollack pointed out that oral medications and monthly topical treatments can safeguard dogs against tick bites. Patrick and Lily Marvin of Topsfield learned this lesson the hard way when their golden retriever, Kevin, contracted Lyme disease despite wearing a medicated collar during a hiking trip in Nantucket. Though Kevin eventually recovered, the experience prompted the couple to switch to chewable tablets for their 3 dogs. It's frustrating because you think you're doing everything right, but ticks are relentless, Patrick remarked. On a hopeful note, researchers are actively working on vaccines to combat tick-borne illnesses. A promising Lyme disease vaccine co-developed by Valneva and Pfizer is currently undergoing late-stage clinical trials. Meanwhile, scientists at the University of Massachusetts Medical School's Mass Biologics Division are exploring antibodies designed to serve as pre-exposure prophylaxis (PrEP) for Lyme disease, though human trials remain pending. Although progress lags for alpha-gal syndrome, University of Michigan researchers successfully tested a nanoparticle treatment in mice, reducing allergic reactions caused by Lone Star tick bites. But this raises an intriguing question: should we focus solely on prevention, or should greater emphasis be placed on developing therapies for those already affected? And how might advancements in tick control reshape our relationship with nature? Share your thoughts in the comments below. We'd love to hear your perspective.